Hello and welcome. You're watching India Fights Back with me, Rajat Kain. In this episode of show, we'll discuss the subject of breakthrough infections, a medical phenomenon indicating that virus has been able to break through the defense created by vaccine. In this case, specifically talking of the COVID-19, the Delta variant, which has high transmissibility and is more virulent as compared to others, contributed to majority of clinical cases in vaccine breakthrough or the cases of infections post-vaccination. Well, the latest study by the ICMR shows that 9.8% cases required hospitalization. 9.8% cases, that is roughly 10% cases which were infected by the breakthrough infection was sought hospitalization. How important is therefore to understand this phenomenon? Remember, in this show, especially for this episode today, we're not going to come to any conclusion. This is discussion on the important aspect of the COVID-19 virus. To have further discussion on this issue, we're joined by a panel of two guests, Dr. Sunil Raina. Many thanks, Dr. Raina, for joining us. He's Head of Community Medicine from Dr. RPGMC, Tanda, and Dr. N.K. Vashisht. He's Dean of Chirayu Medical College and Hospital, Bhopal. Many thanks, Dr. N.K. Vashisht, to be part of the show. Let me start with you, Dr. Rana. How important is it to, to first, understand the concept of breakthrough infection? What is breakthrough infection if we talk strictly of COVID-19 parlance?
First, thanks, Rajat, for having me on the show.
Many thanks, sir.
And it's very important to understand breakthrough, primarily because of the fact that we have now two major players as far as this pandemic is concerned. We have the vaccine there and we have the virus.
Right.
And as you are aware that the virus will keep mutating, it will keep changing because it has to find new hosts wherein it can infect and infect to a degree wherein it is able to survive as well as transmit infections. Now, what vaccine has done is that vaccine has provided some level of protection against getting infected as well as provided protection against severe form of disease. But because of the fact that the virus is mutating, because of the fact that the virus is changing, there are a chance that despite of being infected or despite of being vaccinated with a vaccine, still have the chance of being infected against. Now, this mutant or the variant may still infect you in spite of the fact that you may be vaccinated or previously infected. Now, if you are vaccinated and you get the reinfection, we generally call it as breakthrough infection.
Right.
Breakthrough infection is an infection which happens in a person who has been vaccinated against the infection, but still comes up or reports infection. So this is very important, as I said, because we are in a phase wherein vaccination has been rolled out and we will really know how exactly the virus is mutating and influencing our vaccination process or vaccination programs. This is important because these mutations will literally tell us whether our strategy is unidimensional and our unidimensional strategy of vaccination as the core tool to tackle this pandemic is successful or not. Or we need to look at multi-layered strategy wherein vaccination is a tool and we also need to think of others as we have been always talking of the COVID appropriate behavior. Probably that is what the takeaway from this breakthrough infection will be for all of us in public health as well as in medicine in general.
Right. That's really important. Just stay on, Dr. Raina. Dr. N.K. Vashisht is also with us. Sir, does the Delta variant of COVID-19 still remains variant of concern, a mutant of concern?
Good evening, Rajat, and thanks for inviting me on this show.
Good evening, sir.
As far as the question goes, yes, Delta variant is a matter of concern. There is no doubt about that. Lot many studies have shown that in lot many cases have corrected because of the variant. And it has become a matter of concern in lot many countries now, even in our country. As Dr. Raina said, this virus will keep on showing mutations because it has to fight, it wants to survive. We, on the other, have to fight against it. So it's a two-way process. We are fighting against each other. And we are too, on the other our side, are coming up with various weapons to fight this. In fact, the fortunate part till now is various studies have shown that although it is a matter of concern, because it's a new thing, yet the vaccine, especially in our country, the Covishield, and the vaccine, especially the Covishield one, it is effective even against its Delta variants. That's a very, in fact, a silver lining.
Right.
In fact, just a couple of days back, a study had shown the foreign vaccine, that is Johnson & Johnson, that has shown the least effect on this Delta variant.
Okay.
In a way, if we are lucky enough to have a very potent vaccine in the name of Covishield, which is it's a good fight against the Delta variants. And to my mind, yes, we got to be precautious against this virus in transmission. Yet it is not yet, so much of a cause of a concern in our country at least.
Right. Dr. Vashisht, you mentioned that vaccine produced by Johnson & Johnson is the most reactive against Delta variant. So basically you're saying that will that provide better shield than others?
No, it is the least effective.
Least effective. I got it. Right, sir. Dr. Raina, how often do we come across such a phenomenon of, the breakthrough infection when it comes to virus or any other microorganisms? Is it for the first time that we are seeing the breakthrough infection of this scale, that even after having vaccine, the virus is still able to breach the defense mechanism?
Rajat, we need to understand where are we at this point in time. We are in the situation wherein the pandemic is still unfolding. We have not got rid of the pandemic, or we have not reached the end of the pandemic. What happens generally is when we are in the pandemic, the virus keeps mutating. So it will keep mutating, keep changing itself. It's very rare. It's probably for the second time in the history of mankind that we are using a vaccine at a larger scale while within the pandemic itself only. So we probably did it in 1960s when we had the pandemic, influenza-related pandemics. But we generally don't do vaccination while we are in the midst of the pandemic. So to have data on breakthrough infections is still incomplete. We will still need to work out the data which is available with regard to breakthrough infections. This is not uncommon. If you look at flu pandemic that is being running for a long period of time, if you look at the way we vaccinate in influenza, the common flu that we do vaccinate against. Now, every year what we do, where in the places wherein vaccination is given against flu, what they do is that they identify the most popular virus that is circulating around the area wherein the vaccination is given. And based on that calculation, based on the fact that they have identified the most common circulating virus, they change their vaccines on a yearly basis. So they will identify 3-4 variants and start vaccinating with them. Now, in this pandemic, if you look, most of the vaccines were got in an emergency authorization mode, and we don't have a huge gamut of data available as to how exactly we will keep evolving with regard to our vaccines if we have to counter the changes that this virus is throwing us. So breakthrough infections will happen because we have limited availability of vaccines in terms of innovations at this point in time. So whatever the vaccine will, whatever the virus will evolve in, it has a chance of breaking in the immunity that is being offered by the vaccine at this point in time. If you look at the most robust data that has come up from, Israel was one place wherein there was huge number of vaccinations that was carried out. If you look at the data from Israel and the vaccination that they used the Pfizer vaccine was the one which was used in Israel. The preliminary studies that came from Israel maybe 3 months back, they said that Pfizer vaccine was effective in 88% of cases to prevent breakthrough infection.
Right.
But once the data kept evolving, once it moved ahead, now we are saying that the effectiveness of preventing Delta or preventing breakthrough infection because of Delta in Israel, again, after use of Pfizer, is not 88%, but only 64%. So as the data will evolve, we will get to know how exactly vaccines are reacting to the newer mutations, in particular the Delta, and if we have the Delta plus variants coming up in future. So we will get to know that. But at this point in time, we need to realize that they do tell us one basic thing, that our approach to this pandemic doesn't need to stop at vaccines only.
Right.
More important for the European Union, the Western countries, the US, which had given away the concept of mask, or even for that matter, Israel, which had given away the concept of mask in view of the fact that they thought vaccination is going to prevent them for a long period of time. So it's time to come back to mask. And mask will be one protection which, in addition to vaccination, is going to prevent us against this pandemic.
Right, certainly. So, as expert says, vaccination, whosoever is eligible should take the jab, and also do not forget to maintain this COVID appropriate behavior of wearing a face mask, keep washing your hands, maintaining sanitization, and of course, like, do not forget to maintain the social distancing. That's what expert says, dear viewers. So keep listening to experts, keep watching our show. There we have two experts, Dr. Raina from Tanda and Dr. N.K. Vashisht. He is Dean of Chirayu Medical College. Dr. Vashisht, sir, I mean, so, if we take a look at these cases of, breakthrough infection, how many of them were symptomatic? I mean, so far as the data we have, and what are the usual symptoms? Is it more similar to what usually we have in COVID, or are they more severe or milder?
Breakthrough infections, the latest study shows almost 90% of them are asymptomatic.
Okay.
So the figures we have. And whatever few people they have those symptoms, they are much milder. And definitely the vaccines have given them a protection against the severity of the disease and the mortality of the mortality rate of the disease because of the disease. So vaccination has definitely proved to be protective in most of the cases. And these breakthrough cases, as Dr. Raina said, it is the phenomenon which goes on with almost all the viruses to a certain extent. Here, this has been, since it has been on a very, very large scale, so the breakthrough cases are also proportionately large as compared to other vaccines or other diseases. But at the same time, the COVID protocols, they cannot be forgotten. Even if there is almost 100% vaccination all over the world, yet these COVID protocols of social distancing, the face mask, the hand sanitization, they will have to continue for another 3-4 years minimum. There's no way out to skip that.
Dr. Vashisht, important thing here as you're talking about the symptoms of the breakthrough infection, have we found any particular age group that is which is more susceptible towards the breakthrough infection, or is it across the age groups we are seeing this phenomenon?
You see, it has been the more the particular age group that has been more prone to it is towards the elderly side. In fact, the we had of the third wave spreading in the pediatric group, still it is not yet proved its impact, and we find the children are pretty safe till now. The comorbid people, they are more prone to this breakthrough infection still, and of course, few groups of people who have been rather, I must say, casual.
Right.
Towards taking the precautions or towards following the COVID protocol.
Right.
So basically, and if I don't follow the protocol, if I venture into the crowded market and if I venture into the crowded places and parties, I am prone to it. I should not forget that.
Certainly, we are inviting virus if we are breaking, the well-established COVID-appropriate behavior or protocol, as we may choose to call it. But these are actually protocols because these are small things that can help us in keeping the pandemic at bay. Many thanks, Dr. Vashisht. Just stay on, Dr. Raina. We during the first wave, or to say last year, we had a very well-established chain of thought that people who are either comorbid or from the old age are more susceptible towards catching the virus. Like second wave came, we saw a lot of youngsters, they were the ones who suffered because of oxygen shortages, because of asphyxia, because of everything that we saw during the second wave. And now third wave, the hypothetical third wave, I'll call it hypothetical because, it's still, it's under study. We are seeing the interest group happens to be children. So, when you talk of the reinfection, what as per you would be the most susceptible group?
Before I answer the second part of it, I would like to answer the first part of it.
Sure.
Now, when the pandemic was involved, for us, the area of concern, or the goalpost of concern for us was to prevent death. So we were interested in preventing death. And we were of the opinion that those with severe comorbidity or those with age not on their side, meaning elderly, have a higher chance of dying. So our focus of all strategies, whether it was with regard to communication strategies, whether it was with regard to masking, or whether it was with regard to vaccination, the focus was on the elderly. Now, what does this do is that when you focus on elderly, it creates a sort of an immune debt. So you have a population which is more susceptible than the ones which has been catered to, which has been addressed to in larger numbers. So your elderly could take care of themselves because we said that they have to save themselves. But at the same time, we gave an indirect message that the younger people are more likely not to fall ill. So this was the population which we thought was supposedly healthy. They could venture out, and the infection will not catch them. So this was a population which was in an immune dead status. So their chance of picking up infection was more in the second part of the wave, or the second phase of the wave. So that's why you see more of them being infected than the elderly ones, which was a part of the first part. But if you look at the pandemics in general, if you look at the pandemics that have happened to human beings in past as well. So if you look at the closest that we have to similar nature was the flu pandemic, which happened in 1918. Now, if you look at the waves in that pandemic as well, you will see that the middle-aged people or the younger people had a higher chance of dying when they were infected, primarily because of the fact that they would mount a large amount of immune response. Deaths don't happen because of the infection. Deaths happen because of the way the immunity reacts to infection. So that was probably the cause, was the numbers starting swelling in the second phase, and a large number of them were the young people. The chance of death was also increased in these young people, as would have happened if elderly would have happened to be the most large number of infected people in the second part. Now, as with regard to reinfection or with regard to breakthrough infection, who has the higher chance? As I keep saying, that the numbers for breakthrough infection are still limited with us. We don't have a large people who have been vaccinated with both vaccines at this point in time, both doses of vaccines. So if you have vaccinated around 400 million people at this point in time, the number vaccinated with both the doses of either Covishield or Covaxin is still smaller. So to know who exactly or which age group is exactly being infected with the breakthrough infection is still a matter of speculation. We should not be talking about this. As far as reinfection is concerned, reinfection can happen to anybody who ventures out and seeks infection. Now, the third part is whether the children will be affected or not. Now, to that, I again come to the same immune debt concept. So at this point in time, the focus has been the elderly, the middle age, the younger children have been left open because of the fact that we have continuously kept saying that these younger children will not pick a severe form of disease. So the younger children keep roaming around, they keep playing, they keep mingling with people. And because of the fact that they mingle in huge numbers, the chance of them picking up infection is higher than others, maybe the middle age or the elderly. But the silver lining is that across the world, despite the fact that the children have been infected, they have not reported very severe form of disease. They have generally reported milder form. Of course, the area of concern for us is the long COVID, that the children may enter into it, and the consequences of which are not known to us still. So that is something of a worry for us. But rest of the things that these children presenting with severe form of disease is not at this point in time established with us. So that's how we take it.
Right. Dr. Raina, before I move to Dr. N.K. Vashisht, I'll ask the same thing to him. You know, off late we saw a lot of visuals of people thronging to various tourist destinations and hill stations. Does those visuals worried you? Like, you know, I know we have discussed it threadbare, but we keep talking about the COVID appropriate behavior. So does those visuals, that rush, really worried you? I mean, you know, what is happening? Kya ho raha hai ye? Why people are not following simple things?
Absolutely. I'm worried with it in huge sense. I wrote about it also, and I gave it the name revenge tourism.
Right.
Now, why I'm worried is not just because of the fact that people are moving out, thinking that now this is the time, this 2-3 months time has been given us as a leeway or a gap between the next wave which is expected and the second wave that had happened. So let us have these 3 months of enjoyment. That is one part of the worry, because people will go out, have fun, roam around all places. But it also tells us about the fact that we are more or less destined, or we are more or less acceptable to the fact that the third wave will come, which is not scientifically a wise advice to follow. So we are willing to accept that the third wave is going to come, and we are preparing for that. And in preparation, we are moving out to all tourist destinations, thinking that we have a release from the lockdown. But the fact is that if we don't move to tourist destination, the chances of third wave happening are all the more reduced. It's up to us whether we convert this ripple of a third wave into a huge wave or not. So by going to these tourist destinations, moving in large numbers, we are ensuring the fact that this ripple will become a wave again. So this does really bother me, and it is a huge concern. But this is across the world. I keep talking to people across the world, and this is happening across the world. This is the unfortunate part of the reality.
Yeah, really, really unfortunate, and especially like you come from Himachal, so clearly like there were a lot of places over there, very beautiful hill stations, yet, I mean, this is not the time to actually throng over there. That's really important, extremely important point, Dr. Raina. Dr. N.K. Vashisht, sir, your thoughts, like those people who are thronging to tourist destination, how detrimental that can be in containing pandemic at a larger scale?
People who are venturing out to these tourist places, in fact, I will say they are all very short-sighted, short memory. There is hardly any family today which has not been affected more or less by first or second wave. Yet we have forgotten that, and we are, especially the younger generation, or the between 30s and 40s people, they are out to enjoy the so-called short-lived lockdowns opening up, without realizing they are putting everybody else in the society into a big danger. Third wave, let's hope it doesn't come in, and our vaccination process it carries on at a slightly faster pace. But if it comes in, I'm very sure about it. Even the official figures will be 1 crore plus. There's no two way, or there's no second thinking about it. It is going to be very severe.
Right.
High time we stop all these short sort of enjoyments. Recently, this Supreme Court has intervened to stop this Kamar Yatra, which was could have been a major source of COVID reinfections.
Right.
Unfortunately, few states down south during this program, 3 days, they have not yet been there. They have not been that precautious, and I hope that doesn't result into those super spreaders. So let's hope, but it's definitely not the time to venture for these tourist places.
Absolutely. So let's hope for best, and let's hope people realize that this is not the time to, at least in wherever they are, violate COVID appropriate behavior. Dr. Vashisht, as we close, as we go towards the close of show, sir, just one last question to you, sir. As we coming back to the point of the breakthrough infection, does duration between the doses of vaccination helps or has any impact on propensity to breakthrough?
Yes, sir. Definitely. You see, if we check on the things, the initial duration for both the vaccines were 4 weeks.
Right.
Subsequently, it got increased for the Covishield to 6 weeks, 6 to 8 weeks. Further, it got extended to 12 weeks and beyond. So there were certain, I'll say, extra medical reasons to increase the duration. As at least I've got no hesitation in saying that. Yet, if what are the studies have shown, the best immunity for Covaxin in our country has been about 4 to 6 weeks only, between the two. And for Covishield, it is between 8 to 12 weeks. Extending beyond 12 weeks probably will have certain, lower data as far as the immunity is concerned. And now, of course, as we see the few vaccine producers, they are thinking in terms of third booster dose as well, which is the Pfizer one. Though in our country, both these vaccines, they have not yet thought of a booster dose, but the studies are going on, and it is too premature to say all those things, how long the immunity will last. But the duration definitely does have an effect to give you a percentage of immunity or effective immunity in individuals.
Right, right. That's really important. Many thanks, Dr. Vashisht, for joining us. Dr. Raina, your take, duration of, say, 2 doses or having vaccination of post, getting down with the COVID-19, does it impact or does it have any say in the breakthrough? What is your take?
Look, this is a very important aspect that needs to be dealt with in detail, primarily at the scientific level.
Right.
Why I say is this? Because we have a fixed number of viruses which are, or the viral strains that we know which are circulating around us at this point in time. And we say that we have 2 or 3 vaccines, or maybe around the world, we look at 5 and 6 vaccines which are going to take care of these viral strains. But whenever the new virus will come or the viral strain will come, what it has, whether it has a higher chance of breaking through than the previous strains, we don't know. So what will happen is that if, for example, what has happened in England, England initially thought of a gap of around 4 to 6 weeks. And then they extended this gap to around 12 weeks. They made it 3 months could be the ideal gap between 2 doses. But when Delta struck them, most of the people, most of the scientific community in England started thinking of bridging the gap further. They said that let's not make it between 0 and 3 months. Let's keep it again to between 0 and 4 to 6 months. So 4 to 6 weeks. So they said that let us shorten the duration between first and the second dose to overcome the Delta variant. So if you are looking at variants, then the shortening of duration may be an important thing to do with.
Okay.
But if you are not looking at variants at this point in time, then this 3 months gap is ideally suited to take care of most of the things, because it is programmatically good for us because we are able to take care of more vaccinations in this way, as also being able to provide immunity to the people who get vaccinated. So in that sense, this is good strategy at this point in time. So maybe, but if we have the variants coming up in huge numbers in future, we will need to revise the strategy, keeping in view what are the chances of each breakthrough that this new viral strain is capable of causing. We are doing a study on this. We have started with an ICMR, Indian Council of Medical Research, has started a study around 10 centers in India, wherein we have recruited around 2,500 healthcare workers from our institute as well, wherein we are exactly looking at this breakthrough infection and reinfections. Who are the people who have the higher chance and which type of viral strain is causing breakthrough more commonly than others. We are tying up with the NIV Pune for that, for doing the strain analysis as well for that. So we will get to know more of this in future times. And this vaccination policy can be opened up more in view of the newer evidence that comes up through these studies.
Right, right. Dr. Raina, many thanks for your thoughts. Many thanks for joining us and discussing, explaining to our viewers the very important aspect of the breakthrough infection. At the same time, both are experts. Many thanks to you for once again suggesting viewers and whosoever is watching the show that please keep following COVID-appropriate behavior. Well, that's it in this edition of IFB. Thank you. Goodbye.